Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Jayshree Chander. She's an occupational medicine and family physician, and she wrote the Kevin MD article, A Call for a Moratorium on the Sale of Inhalable Products. Jayshree, welcome to the show.
Thank you, Kevin. Really appreciate being invited to talk with you today.
So we'll get into your article in a little bit, but first off, can you just share your story and your journey to where you are today?
I graduated from the University of Wisconsin in Madison from med school. I did my internship in Minnesota at Hennepin County Medical Center. Came out to San Francisco for a residency in family and community medicine at UCSF, and I did a fellowship in occupational and environmental medicine also at UCSF. Primarily, I was practicing urgent care throughout my career for the homeless and medically indigent and underserved populations of the Bay Area. I've spent a little bit of time in India as well, and now I'm doing primary care.
Tell me a little bit about your practice and how has the pandemic affected your practice?
I'm working with the healthcare system, and it's a private corporation. And our demographic is relatively well-educated, relatively wealthy, it's in the financial district of San Francisco, so a lot of tech kids, relatively young. So the main thing that I've been seeing during these past 6 or 7 months is anxiety and depression and loneliness, and actually overworking. With people working from home, they're finding that they're working a lot. Many people really like the work from home thing. Many people don't like it. But the real, my experience so far has been that the primary impact has been an exacerbation of anxiety and depression. My experience of the pandemic has been a desire to actually calm people down.
And what kind of advice are you giving to patients who are coming to you for increased anxiety and depression?
I have learned over the course of my career that advice is probably the worst thing a doctor can give people. And that what we want to do, that my approach is actually to listen and ask questions, reflect, and elicit the advice from the person themselves, right? Because I think that a lot of patients actually, when they start to question, like because of my questions, they start to question their thoughts and inquire into their thoughts that are making them anxious, then it produces their own relief. I teach them how to self-empathize with their feelings and identify their needs, and then think about strategies that they can use to meet their own needs. So the homework is actually theirs. They have to find it. I do try to help them at least start getting better sleep, because that's like the foundation. Some people I've had to start on medications. Many of my patients don't want to start on medications. It's just that demographic, I think, there. And maybe it's also the San Francisco Bay Area culture.
Sure.
People try the holistic approach a little bit more. And maybe that's also the patients that are drawn to me, who see my profile and know that, I'm kind of a medical minimalist.
So let's transition into your Kevin MD article, A Call for a Moratorium on the Sale of Inhalable Products. Now, for those who haven't read the article, can you just walk my audience through it and maybe share the story of why you decided to write it?
It was at a time in the course of the pandemic that we were concerned about our ICU capacity, the availability of ventilators. We also were very clear that the impact was primarily on people who had underlying diseases, underlying heart disease, underlying lung disease, obesity, diabetes, and other immunocompromised states. So that's our population of concern, and the elderly. My general approach to medicine and public health is to think horizontally as well as vertically, because I think that's what gives us a whole picture, right? So if we're only focused on the virus and testing and tracing and tracking, then we will address one disease with all our efforts. We will invest whatever it is, $500 billion in one disease. Whereas if we just step back and look at underlying diseases that are predisposing to the vulnerability of COVID, then we are getting more bang for our buck. And we are getting additional benefits from our efforts. So, in my opinion, and this is an opinion, it is not a fact, it's an opinion, and I'm willing to own it as an opinion, that if we were to have a massive national quit smoking campaign or a massive global quit smoking campaign, we could reduce the mortality of COVID-19 significantly. But we would also reduce the mortality from influenza, from pneumonia, from lung cancer, from emphysema, from heart disease. We would be having multiple benefits for the price of the same campaign. A moratorium is a temporary hold on the sale of or the participation in a specific activity. So I recognize that people are addicted to nicotine or are very habituated to using nicotine, and especially with an increase in the stress and anxiety and depression and actually just lack of other activities to do, that smoking may actually be increasing during this time. I actually haven't seen the data on whether people are smoking more or less.
Sorry, to be clear, you're talking just about smoking. What about vaping and other non-smoking related inhalable products?
Inhalable products would include vaping,
Vaping.
and
Okay.
it would include marijuana, it would include nicotine, or whatever else people are smoking. I mean, our lungs are not designed for smoke. They're designed for very, very clean air. They're not even designed for polluted air. They're not designed for air that is full of the smoke from wildfires. Like, that's not what our lungs are designed for. I would suggest that in a time when we are focusing our public health efforts, our clinical efforts on reducing the impact of COVID-19, and we're in a state of an emergency, a global emergency, putting a moratorium on the sale of inhalable products would actually help us in our efforts.
We're talking to Jayshree Chander. She's an occupational medicine and family physician. She co-wrote the Kevin MD article, A Call for a Moratorium on the Sale of Inhalable Products. Jayshree, so we talked about from a policy standpoint in terms of what you think we should do, but how about in the room face-to-face with a patient? And if they're using inhalable products, if they're smoking, if they're vaping, so what are some of the techniques that you use to help these individuals perhaps stop smoking, especially during a time of COVID?
Well, I counsel them. I actually have a few patients who did quit smoking during COVID, and I have some patients who increased their smoking habits in COVID. So again, like, I don't take the advice approach. I take the information and empathy approach. So I offer the information, and I do have a podcast on my podcast site where I have interviewed a researcher who has done research on the toxicity of cannabis smoke, showing the preliminary results are showing that the toxicity of cannabis smoke is essentially as toxic as tobacco smoke, and that we shouldn't be thinking that cannabis smoke is less, marijuana smoke is less toxic. And there is that public perception that somehow tobacco smoke is more harmful, and that is actually not true. So I offer that information because I do have a lot of patients that don't smoke tobacco, but they do smoke marijuana. I offer that information, and that often is new information to them. But more, my approach to either product is to inquire, what is the needs? What are the needs that are being met? When you find yourself wanting to smoke, what needs are being met for you? And we list out those needs and ask them, because unless your needs are being met, you're not going to be fulfilled and satisfied. And that's the key to a fulfilling and satisfying life, is to have your needs get met. So let's brainstorm, because for every need, there are at least 100 strategies to meet your needs, right? So let's think of just even 3 to 5 strategies to meet each of those needs that smoking meets. And people find it very helpful because they realize, oh, I can get my needs met. I don't have to remain anxious just because I'm not smoking. I don't have to remain bored or I can create another ritual. I can find another way to connect with myself, with the there's so many reasons that people choose to smoke, and it does make a difference.
And my final question, Jayshree, what is your take-home message that you want to leave with the Kevin MD audience?
My take-home message is that, at least in terms of this article, addressing our underlying health is critical, and it has multiple benefits, including reducing the impact of COVID.
Thank you so much for sharing your insight, and thanks again for being on the show.
Thank you, Kevin. Thank you for inviting me, and thank you for sharing my article, and I look forward to more collaborations with you.